Hello everyone, this is Dr. Ezi, and I'm going to help you to pass your MRCS Part B OSCE exam, okay? So if you did not subscribe yet, please subscribe because these videos will come to you weekly, and we are trying to collect all the information you need before you get to your exam. And believe me, this information is given to you for free. But if you focus on it, because it's huge information, believe me, you are going to pass the exam, okay? So today we are going to discuss another critical care station. And this critical care station is very common. It is called abdominal aortic aneurysm, okay? They are going to give you a scenario about a patient. Maybe he's 100 years old, I don't know. Anyway, and this patient had a ruptured abdominal aortic aneurysm. So he's old and he has a ruptured abdominal aortic aneurysm. Okay, so this patient received a huge blood transfusion, definitely, because he lost a lot of blood. And this patient also developed hypothermia. So this is the scenario. From the scenario now you can understand which topic will be touched or asked in this station. This station is like this, and it covers all these aspects. Okay, so to make a map here, they are going to ask you about abdominal aortic aneurysm itself. You have to know that they are going to ask you about this at the end. Okay, and they are going to ask you about blood transfusion, okay, in detail, and this will be maybe at the middle. And they are going to ask you about hypothermia, and most probably this will be the beginning for you. Okay, so let us start here. The first question here will be asked. It will be they are going to ask you define hypothermia. Okay, what is hypothermia? Hypothermia is decrease of the core temperature to 35 degrees centigrade or less. Okay, is the reduction or decrease of core temperature to 35 degrees centigrade or less. This is the ideal answer for this question. The next question, they are going to ask you, how can you measure? How to measure the core temperature? So number one, orally, this is known to you. Number two, you can check it from the axilla. Number three, rectum. Number four, esophagus. And number five, tympanic membrane. This may be new to you, but it is involved also, okay? So orally, through the oral cavity, through the axilla, rectum, esophagus, and tympanic membrane. These answers are more than enough, okay? The third question here, they are going to ask you what is the cause or what are the causes of hypothermia in this patient, this specific patient in the scenario, okay? Fine. So, first of all, this patient, number one, lost a lot of blood, so he will be in shock, right? Number one. And number two, this patient will receive blood, and this is an emergency, and most probably there will be no time to warm the blood, so it is a cold blood, okay? And before that, during his resuscitation in the way to go to the theater, he is receiving a huge amount of fluids, is it right? And they will be cold also because this is an emergency. Okay, so in this case here, he will receive a lot of things that are cold, and he is in shock. And you can add another factor here, okay, because this patient most probably developed hypothermia intraoperatively. You want to add that this patient had laparotomy, so he had an exposed viscera, right? His abdomen is outside. They opened everything inside. It is laparotomy, right? So he is exposed by evaporation and radiation of his heat. He will lose temperature. He will lose temperature. He will lose warmth. So he will get cold. So these are the three factors that will participate in the hypothermia in this patient. Okay? Well, so we are going to the next question here, the fourth question. They are going to ask you, what are the complications of hypothermia? Okay? And to mention complications, actually you have all the systems of the body are affected by hypothermia. Okay? If you start with the cardiovascular system, this patient will develop arrhythmias. He will develop what they call it, he may develop MI also, myocardial infarction. Well, and as you know that this patient is anesthetized, so his cardiac output is low. But these are the common complications here. Okay, let us go to the second part. In the respiratory system, this patient will develop something called pulmonary vascular resistance. It will increase this pulmonary vascular resistance. Okay, and this will lead to something called VQ mismatch, and this will lead to hypoxia, right? The oxygen that will get delivered to the tissues will be low, and this is also a problem. This will increase the metabolic acidosis. So he's in shock. He will be in metabolic acidosis, and with this also, he will get more acidosis, right? Okay. So what other system we can mention here? We can mention the renal system. So in the renal system here, you will have reduced renal blood flow. He's in shock, right? And he's in hypothermia. So everything is not working well. The cardiac output is low. So due to the low cardiac output, he will have a low renal blood flow. And due to that, he will have a low GFR. And he may get worse even. He may go to failure if he has predisposing factors to that. Well, let us take another system. We can take the blood itself, the hematological system. The hematological system, first of all, this patient cannot stop his bleeding. He will have a coagulation problem. Why? Because he is hypothermic, and hypothermia will lead to defected platelets. Okay, so the primary blood will not be formed in the right way, and accordingly his bleeding will not stop. Okay, and this is a disaster in itself. Fine, this is the first point here. Okay, so this patient most probably will have more fibrinolysis. We will continue in the hematological point here. Okay, we are still in point 4, fourth system. Okay, and we talk about platelets. He will have an increased fibrinolysis. He will have increased hematocrit. Okay, he is going to have a very important thing here, and is that it is related also to the respiratory system, but it is more related to the RBCs. there will be a shift of the oxygen dissociation curve to the left. What does that mean? It means that the affinity of the hemoglobin to oxygen will increase, okay? And when it increases, the RBCs will keep the oxygen, so the tissue will be, or the tissues will be low in oxygen. In other words, they are hypoxic, right? Well, so this will make more problems. So the temperature itself, the low temperature itself, will take the curve to the left, will increase the affinity to oxygen, and will cause hypoxia. Okay, so these are some of the complications that may occur. Okay, well, we will go to the fifth point here, and the fifth point is it is metabolic complications. So the metabolic complications, number one, you will have a low basal metabolic rate, because you know that the metabolism works in an ideal temperature. If he is hypothermic 35 or less, he will have a big problem with metabolism. This is number one. You know that he will develop metabolic acidosis, right? He's shocked, he has hypothermia. Number three, from a metabolic point of view, he will has increased insulin resistance, and he will have hyperglycemia, right? He will have hyperglycemia. In other words, he will be diabetic at that point. Okay, well, let us go to another system. We can go to the GIT. What will happen in the GIT? Okay, so in the GIT, there will be reduced gut motility. This is number one. Okay, we will have also some problems with the enzymes of the liver. So the activity of the enzymes in the liver, as the liver is a part of the GIT, will also be, all the enzymes actually will be reduced in activity, and the GIT will be very lazy. Okay, well, what else? We will take the CNS finally, and the CNS will get lazy also, and the patient will get reduced level of consciousness if he is awake, but he is now, if he developed hypothermia before anesthesia, so he will be, has reduced consciousness, and he may have coma, and if he is intraoperative, he may be in coma and he will not wake up easily. Okay, so these are the complications in general here. Okay, so these are some questions, 4 questions of the station. We will stop here and we will try to continue in hypothermia itself in the next video. Thanks for listening.